Hi, I'm Joe Nemeth. I'm a periodontist in Southfield, Michigan, and today I think we're going to talk about what can we do to minimize getting long in the tooth. Now, the term long in the tooth, it comes from people getting older, because when they get older, their gums tend to recede. So you don't want to be long in the tooth if you can avoid it. It's not necessarily a complimentary term. What are some of the things that cause being long in the tooth? Well, clenching or grinding during your sleep can contribute to that, but one of the main things, and one of the things that I almost always see, is over-vigorous or improper toothbrushing. Because if you're brushing your teeth too frequently, if you're a clean freak or a neat freak and you got to get those teeth clean, you're likely to cause more damage than good. The more you brush your teeth, and the longer you brush for, and the harder the brush, the more you're going to traumatize and irritate those tissues. So you have to be very careful with your brush. Let me give you an example of what can happen. Okay, here are some teeth right here, and here's the gum tissue. Well, if you're brushing and you're brushing real vigorously, look at what's going on. Can you see that recession right there? That yellow stuff? That's the roots of the teeth. The roots of the teeth tend to be yellow. They don't look so good. And then if you continue brushing, the gum tissue that's left isn't gum tissue anymore. It's what's called mucosa. Mucosa isn't meant to withstand the forces of brushing, and it tends to get irritated and sore very easily. The other thing to remember is when you have gum recession, that gum is attached to the bone. Therefore, if you lose gum, you're likely to lose bone with it. It's the bone that holds the teeth in. So if you lose gum, you lose bone, you lose support for the tooth then becomes loose, you're more at risk for losing that tooth. What else about recession? People come to me, I can't have anything cold, or whenever air hits it, or when I brush it, it's really sensitive. Why is it sensitive? Because the roots are much more sensitive than the crowns are, and when those roots are exposed, they're sensitive. Sometimes they come in because I don't like the way it looks. I mean, this is really bad. Can you do something about that? So the appearance is another reason. Sometimes people come in because when they're brushing, it's just really sore. Also, the roots are more subject to decay. So again, if you have recession, you can get decay more easily on that dentin because it's not enamel. So when you brush, if you really want to be safe, use a soft brush and kind of direct the bristles toward the gum and brush downward on the top, wiggling it slightly, coming down, wiggling it slightly, coming down, so that you're not scrubbing it hard and causing it to recede any more than necessary. A lot depends on your tissue type too. If you have thin gums, you have to be way more careful than if you have thick, heavy tissue. That thick, heavy tissue can withstand brushing better. If you've had braces, very often that'll cause the roots of the teeth to be more prominent, or you simply may have more prominent roots. That's another thing that makes recession much more likely. So thin tissue, prominent roots, be careful. If you've had trauma or injury, sometimes that can cause recession. But the main thing is the tissue type combined with toothbrushing is what we find. When we do have recession, what we can do is actually take gum tissue from another area and actually put it right there, and I'm stealing gum tissue from an area that I shouldn't be stealing it from, which we don't normally do, and we can repair that. We can largely repair it by doing a graft. But the worse this recession, the more difficult it is to repair. And here's kind of an interesting example. A young man came to us with recession around these lower front teeth. You can see how long these roots are, and here, and here, and here. So we took a gum graft and we placed it in these areas, and you can see how it looks. This tissue is thicker, it's not thin, it's much more resistant to recession, and it's much more comfortable. He's not having the sensitivity that he was having before. Very pleased. So there may be a lot more to this, but this is the essentials about brushing and recession is something that we like to minimize or avoid if we possibly can. Brush in moderation, don't be too vigorous. If you've got a problem, check with your dentist and see if something can or should be done about it. Okay, good health, take care, have a good day.